So now we're going to switch this afternoon to looking at the policy and technology perspectives, or I should say policy as it pertains to technology perspectives, and look at the considerations we have to give to policy and how policy can either support or hinder the use of technology toward achieving and creating health equity. And so we will also look at some of the policy opportunities in the use of technology as well. I guess I should say that I'm a member of the round table. I feel like I've been here for so long. I'm part of the fabric in many ways. So our speakers, I'm going to introduce them all at one time. You have their bios. I'm not going to go into detail. I'm just going to stay at the high level. And I'm going to introduce them in the order that they're going to speak, which is in reverse order from what you have in your program. We talked about powwow a little bit, and we think it'll work a little better in a different way. They'll each talk for about 15 minutes, and then we have time for questions and discussion at the end. So the first presentation will be Tessie Guillermo. And Tessie is the president and CEO of Zero Divide, which is a consultant organization focusing on technology adoption and innovation to improve health, economic opportunity, and civic engagement of disadvantaged communities. And she's going to start with a very broad perspective. And then we're going to have Brian Raymond, who is a senior health policy consultant at the Kaiser Permanente Institute for Health Policy. His role requires him analyzing emerging policy issues, which of course this would absolutely be in his bailiwick, given that technology raises several policy issues, and supports the health policy decision-making process within Kaiser Permanente. His current areas of focus include e-health technology to address health disparities. So he's going to bring his wisdom to the discussion this afternoon. And finally, we have Noam Ziv, who's the founder of, I hope I pronounce this correctly, Kesembe? Okay, close enough? Well, tell me how. Kesembe. Oh, that's different. Kesembe, okay. He's the founder of Kesembe, and he's a recognized thought leader, experienced systems architect, and advisor to numerous startups in wireless communication and mobile healthcare fields, and is the founder and CEO, as I said, of Kesembe Incorporated. And he's going to bring the technology piece of it. So we're going to start with Tessie, who's going to give us a broad perspective. Raymond will then pull in the policy piece of it, and Noam will then add the technology. And then we'll open it up for discussion when they're done. Okay? So let's please start with Tessie.